Today I want to talk to you about a very real need we have here in Hawaii. So how many of us with children would give our crying, fussy, teething 2-year-old the bottle of child-proof pain reliever, you know, children's Motrin or something, without opening it and expect them to treat themselves? None of us would do that, yet there's a whole lot of people in Hawaii who are currently faced with that situation. These are the medical marijuana patients. They are recommended medical marijuana, but there's nowhere for them to legally obtain their medication or the plants to grow. So should medical marijuana dispensaries be legalized like other drugstores in Hawaii? Yes. So today I'll give you a brief background on the medical marijuana policy here in Hawaii, as well as go over why the opposing parties' arguments are wrong, how the dispensaries will benefit everyone, and what it is we can do to make medical marijuana dispensaries a reality here in Hawaii. So medical marijuana became legalized in Hawaii 14 years ago in the year 2000. According to freshapproachhawaii.org, we now have over 12,000 medical marijuana patients. There's a bunch of conditions or diseases that qualify, all of which are described as debilitating. There's legal limitations as to how many plants you're allowed to have, as well as usable marijuana that you are allowed in your possession. There will finally be one change made according to procon.org effective January 2nd, 2015, that your limit on plants will still be the same, but you no longer have to differentiate between mature or immature, and instead of 3 ounces on hand, you're welcome to have 4 ounces on hand at all times. However, there still will not be any legal means for the medical marijuana patients to receive their medication. So where do they get their medicine from? This is the question that makes me wonder whether or not medical marijuana in Hawaii is really realistic. Without the medical dispensaries, it's not. According to the Medical Cannabis Coalition of Hawaii, they state it's legal to have marijuana, illegal to get it, leaving patients feeling like prisoners of the system or feeling like criminals having to go to the black market to get their medication. Many people oppose medical marijuana dispensaries, claiming that the dispensaries will cause crime rates to go up, as well as use of marijuana among teenagers to go up. Both of these claims have now been proven wrong. The Americans for Safe Access, the ASA, in 2009 released a report saying that the crime rates actually go down and public safety goes up with the presence of medical marijuana. They contribute to the security and surveillance implemented by the dispensaries. LA Chief of Police Charles Beck, I believe is his name, recently stated that in the last 11 years since implementing the dispensaries, crime rates have continued to fall, and as of this year are the lowest they've been since 1949. There's also a study released from the Rhode Island Hospital that compared over 20 years of data from medical marijuana as well as non-medical marijuana states that shows that there was no significant increase in marijuana usage among teenagers since implementing the policies. So both of these claims, while they are legitimate concerns, they have been proven wrong, and now we have the evidence supporting this. So now that those have been proven wrong, we can talk about the benefits of medical marijuana. Everyone benefits from the dispensaries being legalized in Hawaii. Most obvious are the patients. They will have legal, immediate access to their treatment, as well as a safe place to medicate. Under current policy, they are not allowed to medicate in public places, workplaces, or in moving vehicles, so that many already established dispensaries in other states do provide a place for them to medicate, as well as other social services, which in a study released in 1998, patient-to-patient contact is the best therapeutic setting for ill patients. So that's another benefit of having dispensaries and other medical marijuana patients, coming into one place. With dispensaries, there's also competition between the growers, resulting in stronger strains of marijuana. According to the New York Times, it's up to 25% THC, which is the active ingredient in marijuana, compared to the previous 6 to 9%. And then the knowledgeable staff in the dispensaries can tell you which strains will work better for which conditions and ailments. Next, the economy will greatly benefit, generating state tax revenues. According to the Marijuana Policy Project, the report put out says that current states with medical marijuana dispensaries implement a non-refundable application fee ranging between $1,000 to $5,000, and then there's a annual registration fee ranging anywhere between $5,000 to $20,000, and state sales tax being implemented between 2.9% and 8.1%. Steve D'Angelo from Harborside Health Center in Oakland stated that his dispensary took in $1.2 million in sales tax for his city from marijuana alone last year. Along with the dispensaries being implemented, they bring new business into the areas and feed the surrounding businesses, which can also be beneficial to the community. There are reports of bringing in dispensaries actually revitalizing the communities by bringing in the new business, and then as previously stated, community will benefit from the crime rates going down and the public safety going up. And on top of that, if that's not enough, growing the plants, produces oxygen, more fresh air for everyone. So, you know what? Why not make medical marijuana dispensaries legal in Hawaii and make that medicine that is so needed by these suffering patients available to them legally and immediately? To make medical marijuana dispensaries a reality here in Hawaii, there are several things you can do. You can write a testimony to the state legislature at capitol.hawaii.gov. You can form a Big Island Americans for Safe Access chapter at the safeaccessnow.org/Hawaii_advocacy. Join the Medical Cannabis Coalition of Hawaii at mcchi/join. Or spread the word. There's lots and lots of resources available online. Here I have a few listed: the Drug Policy Alliance, the Marijuana Policy Project, which I mentioned earlier, Patients Out of Time, NORMAL, Americans for Safe Access, and the Drug Policy Forum of Hawaii, which basically has all of these resources and the current laws and everything on their website. There's many more. These are the ones that I came across numerous times throughout my research, so that's why I put them here. So I thank you all for listening. I hope we can together make medical marijuana dispensaries a reality here in Hawaii and help to provide some relief for our medical marijuana patients of Hawaii. Thank you.